Welcome to Lawline with your host, Alan Schnorman. Mr. Schnorman is a distinguished trial attorney, author, and lecturer. Each week, Lawline will bring you the most knowledgeable experts in the field of law today. And now we introduce our guest and our host, Alan Schnorman.
Welcome to Lawline. The issue of voluntary testing versus mandatory testing to detect the AIDS virus has always been a controversial one. The recent results of a study on the beneficial effects of using the drug AZT before symptoms develop from the disease will add new emphasis to the need for early testing. Today we'll look at the AIDS test, the pros and cons of testing, and the implication of the drug AZT. Our guests are David Hansel, Legal Director of the Gay Men's Health Crisis, and Professor Ronald Baer of the Columbia School of Public Health and author of Private Acts, Social Consequences, AIDS, and the Politics of Public Health. Hello, David. Hello, Professor Baer. David, well, who should be tested in today's atmosphere?
Well, Alan, we have had some very hopeful news in the last couple of months. AIDS, what we call AIDS, is really the end stage of a long disease progression. And what we've discovered recently through some testing programs is that AZT, when it's given early to people in the progression of the disease, can actually postpone the development of symptoms and the development of full-blown AIDS. So anyone who is at risk for AIDS or thinks that they may be at risk for AIDS from sexual contact or for other reasons should very carefully consider the possibility of testing.
Professor Baer, why don't you tell us, who's at risk?
In the United States, it's men who've had sex with men, whether they're gay identified or bisexual, or whether they've had a single experience. It's people who use drugs, especially those who shoot drugs intravenously. It's the sexual partners of drug users. It's the babies who were born to mothers who might have been infected. Sometimes people who've come from places where the disease is endemic, like Haiti. In fact, everyone is biologically at risk. But given the context of the United States, we know that the disease is distributed unevenly, and it's really a fairly well-defined group of individuals who are most at risk.
So, Professor Baer, is it your advice that if you're not in one of these risk groups that you've just outlined, you don't have to run to your doctor and be tested?
I think it would be a big mistake if you've had a monogamous relationship, monogamous heterosexual relationship for the last 10 years, or if you've had a monogamous relationship with another man for the last 10 years, there really is no reason to go to get tested. I think that in our desire to make sure that the right people get tested, we shouldn't create kind of an atmosphere where everyone feels they have to run to get tested.
Well, David, let's take the other example. I mean, Professor Baer is talking about the monogamous relationship. What about someone who's single for the last 10, 15 years and has been around and dates and has many sexual relationships? Are they at risk? Should they be tested?
They may be at risk, and if for no other reason than to put themselves at ease about their own status, they may want to consider being tested. There's good reason to do that, particularly now that we know that with those test results they will be armed with information that can actually make a difference for them in protecting their health if they do turn out to test positive.
Well, there is one other element that has to be, it's not simply the question of whether or not you're at risk that should determine whether or not you go and get the test. If you're going to get tested as a way of finding out whether you're infected so that you can start early clinical intervention with AZT, let's say, you should be pretty sure that the drug is going to be available to you, that you're going to be able to afford it, there's going to be a doctor who's going to take care of you, a clinic that will take care of you, that if you don't have insurance, that Medicaid will pick it up. I stress this because it's very easy to encourage people to get tested because it's good for them, and then only afterwards to ask the question, where am I going to get my treatment?
Yeah, but Professor, isn't it correct that if a person proves positive for the AIDS virus inside them, and yet there's no symptoms yet, and there have been studies that at least if you take AZT, maybe you have less of percentage. I'm not saying whether it's 50% or 60%, but less a percentage than developing the full-blown symptoms. Shouldn't everybody avail themselves of this if possible? And hopefully that the public health system will catch up to it?
Well, I don't know. If I said to you, you should go get tested for diabetes, but there's no place in the city that's going to treat you if you are diabetic, I'd have second thoughts about going to get tested.
Well, I assume that there are at least some places that you could be receive AZT in the city.
Not so fast. If you can afford it, yes. But in the city today, for instance, if you know you're infected and just want to get an immunological workup to see how bad you really are in terms of your immune system, you may have to wait 3 or 4 months just for the workup.
And there's another set of considerations, too, that I think people have to keep in mind, which is that if they're tested, unless it's in a truly anonymous setting, if they're tested in any way in which that information is recorded, it can then be the basis for all sorts of discrimination against them. And we have seen people lose their jobs, lose their housing, be denied insurance because they've tested positive for the AIDS virus.
But I think
Professor
that,
Baird, what about this test that I heard? You can go to your doctor's office that's coming out, and within 10 minutes he can tell you whether you have AIDS or not.
don't hold your breath.
Meaning?
Don't hold your breath. The test doesn't exist yet. There is no test online that is going to test that way. When we test someone for the virus, it requires an ELISA test, which is a test which is quite sensitive. It captures many more people than are truly infected, and then you need a backup test called a Western blot to make sure that you are truly infected. I actually want to disagree with something that David just said. In the past, we have stressed the importance of anonymous testing because anonymous testing was a sure way to make sure that the test results couldn't be used in a way that would put you at risk for losing your job, losing your insurance, losing your house, losing your apartment. But now that we're talking about clinical situations, if someone finds out they're infected, the first thing they have to do is go to a doctor. And in a doctor-patient relationship, it's not anonymous. What really is important is the protection of confidentiality. So although I think it's really important to have anonymous test sites available, what we really have to stress is the importance of the protection of confidentiality.
Does that doctor have to report that he's treating an AIDS patient?
In the state of New York, he is not required to report the fact that he is treating a patient who is tested HIV positive, in other words, tested positive for antibodies to the AIDS virus. If he is treating a person who has actually been diagnosed with AIDS, then there is a reporting obligation with confidentiality protection for that information.
Well, what is reported? The name of the person, the address?
Yes, but that information is kept confidential by the state health
Well,
department.
let's take it one step further. Let's assume that you're the doctor and you know that that person hasn't told his wife because he's embarrassed because he got it from somewhere that he really doesn't want to reveal.
That's a...
What happens?
That's a very difficult issue. We have a new confidentiality law in New York that protects people with AIDS or people who are HIV positive, but it does give doctors the right under certain circumstances to share that information with people who may genuinely be at risk because of sexual activity if the doctor is quite certain that the patient is not going to voluntarily make that disclosure.
Professor Baird, does the doctor ask the patient, have you told your wife, have you told your boyfriend?
I think a good physician in treating someone with HIV infection has a responsibility, professional responsibility, to counsel a person to say, if you are infected, you have an obligation, a moral responsibility to tell your sexual partners that you are infected. If you don't think that you can do that yourself, and if you think you need some help in warning your partner, I will help you. If it turns out that you have a patient who says, I'm not only not going to change my sexual behavior, because I have never used a condom with my wife, and I'm certainly not going to start using a condom now.
Because
and
she'll suspect something.
And if the guy says, and I'm not going to tell her, and she has no reason to suspect that he's bisexual, let's say, or that he has shot drugs in the past, then I think the doctor has a responsibility to breach confidentiality and to warn that person. Now, in New York State, what the law says if you breach confidentiality under those circumstances, you can warn the spouse, but you may not mention the potential source of infection. In other words, you can tell Mary Jones that she is at risk for HIV infection, but you can't tell her it's
That it
from
might be
John
your
Jones.
husband?
Right.
Well, that's...
Well, that's a compromise.
Let me ask you this. I know that in New York State currently there are 25,000 reported AIDS cases. Nationally, there are 100,000 reported AIDS cases. How many of those cases right here in our city are heterosexual?
It's hard to figure out. Most of the heterosexual cases in New York City are either IV drug users or the sexual partners of IV drug users. Still at this point in New York, I think it's fair to say that most of the cases are gay or bisexual men. But those numbers are going to begin to change very dramatically in the next few years. In the next few years, more and more of the cases of AIDS will be black and Hispanic, poor men and women who are infected because of drugs, because they use drugs or because their sexual partners use drugs.
Yes, but there's still a connection between one of the high-risk groups as you just outlined it.
Absolutely.
When will it actually come into a group that is not now a high-risk group?
I think that's probably unlikely. There are some people, obviously, who will who are infected because they got a blood transfusion, who, aside from the fact that they got a blood transfusion, had no other risk factor. And we know cases like that. But it seems unlikely to me that the virus will break out, as they like to say, into the kind of heterosexual community that is non-IV drug using, partially because sexual contact across class and racial lines is fairly infrequent.
We're going to cover this again right after this break. You're watching Lawline. Stay with us.
There's a reason people whisper when they tell you a rumor. It's because 9 times out of 10, it's not true. Take all the rumors about AIDS. People are saying you can catch AIDS from a mosquito bite or in swimming pools. The fact is, there isn't a single case of AIDS on record caused by casual contact. It's up to you. You can believe the rumors, or you can get the facts.
Rumors are spreading faster than AIDS. Call your local Red Cross for the facts.
The party's over. All over one for the road. All over for the 25,000 Americans who die each year as the result of drivers who drink. Drivers who don't realize how little it takes to turn the average social drinker into a tragedy. So please, take this advice from this station and the members of the New York State Bar Association. When in doubt, don't start out.
And now a word from the American Lung Association. Your lungs are an incredible piece of machinery, but your lungs are also incredibly delicate. Diseases of the lung are among the most frequent causes of suffering, disability, and death in the United States. Lung cancer is now the #1 cancer killer in America among both men and women. Chronic bronchitis and emphysema are marked by chronic obstruction to the airflow. Among chronic diseases, asthma is the leading cause of school absenteeism. Yes, TB is still with us. In the past year, over 22,000 Americans have contracted TB. Lung trouble can come from the air you breathe at work, but thanks to the American Lung Association, you can breathe a little easier. They're working to fight all this lung disease. Your lungs are a miracle. Take care of your lungs. They're only human. And if my lungs weren't in great shape, I couldn't have said all this. The American Lung Association. The Christmas seal people.
Hello, you're watching Lawline. I'm Alan Schnorman. Today we're discussing AIDS. With us is David Haskell, who is the head of legal services of the Gay Men's Health Crisis, and Professor Baer of the Columbia School of Public Health. David, what is the status? We have rumored or statistically 1 million people out there who are walking around with the AIDS virus in them. What's the status of mandatory testing?
Mandatory testing is taking place in a number of different, primarily federal programs. Federal prisoners are being mandatorily tested. People who are applying to change their immigration status are being tested. So a variety of federal areas.
Army?
But in New York State at this point, in the Army as well.
Military?
That's right, the military is testing everyone. New York State, however, has just adopted a law which actually prohibits mandatory testing within the state of New York, except, of course, that the federal government is exempt from that. But we now have restrictions which require in New York State that anyone who is tested must give their voluntary informed consent first and understand what the test means, why they're doing it, and make the decision to be tested themselves.
Professor Baer, what about newborns?
Well, when we test a newborn, at this point, what we find out basically is whether or not the mother is infected, because all newborns carry the antibodies to the virus that their mothers have.
Is there mandatory testing now?
No,
in
there
newborns?
isn't, not yet. But I think that it is likely within the next year or so that there will be mandatory testing.
Throughout the United States?
Probably. We have mandatory testing for newborns right now for a whole host of disorders. One disorder called PKU. We test infants on a mandatory basis because it's important to identify those babies. There's a therapy that's available, and if we don't use the therapy, those babies will have mental retardation. If we talk about testing newborns, what we have to ask is, do we have a test that will truly identify infected babies? Do we have a treatment which we can provide to them? And is that treatment going to be affordable?
Professor, everybody wants to know what's going to happen tomorrow, what's going to happen next month and next year.
Mm-hmm.
Right now, our hospital emergency rooms are packed.
Right.
It's difficult to get a bed in almost any hospital here in our city as well as metropolitan New York. What's going to happen in 3-4 years?
Much depends on how effective AZT is and a whole host of new drugs are. But it seems to me that we have known for a long time that by the year 1991, 1992, that there were going to be an enormous number of AIDS cases in New York City requiring hospitalization at least at some point during the course of a year. And unfortunately, very little has been done. We have had lots of facts and very little planning.
What's going to happen?
What's going to happen? We're going to have to spend money on hospital beds. And if we don't spend money on hospital beds, people will be dying in the streets. That's a bald fact. We have to decide whether we want to pay it. Look, we live with people sleeping in the streets right now. I get off at 168th Street and Broadway in the morning, and in the winter the platform is lined with men who don't have homes. We may simply get used to the fact that people are going to die in the streets. There's only one way to avoid it.
We also need to provide care out of hospitals. And what the recent studies, I think, demonstrate, and what is most hopeful about them, is that we're on the verge of the point where we can treat AIDS as a chronic disease, a disease people will have for long periods of time. We don't have a cure, and we're not on the verge of a cure, but a disease that we can control to a large extent with the right balance of medication. But we've got to make that available to people in primary care settings outside of the hospital
But
as
that's
well.
all going to be very, very expensive.
Absolutely.
You know that Boroughs Welcome has just lowered the price of AZT.
By
8,000
20%.
By 20%.
$8,000 a year to what?
What is it, $6,000?
$6,400.
The point is that all of the treatments coming down the pike are going to be very, very expensive. And we're going to have to decide as a society how we're going to pay for it. Because most of the people who need it don't have the money to pay for it.
Well, David, what happens if somebody needs AZT, he's on Medicaid, does Medicaid supply that to him?
Medicaid does. Medicaid now, I think, in every state pays for AZT. There's also a federal program which the Senate has just, the Senate committee has just provided funding for to provide AZT to people who don't qualify for Medicaid and yet can't shell out the $8,000 a year to pay for it.
Isn't that inconsistent what Professor Baer is saying? He's trying to allude to that you will not be able to get AZT.
Well, getting AZT is only one part of the equation. First, you have to be able to monitor your immune system to know when you should begin taking AZT. That requires a very expensive set of testing. It can be done in a doctor's office, but it requires periodic testing, which is fairly expensive. And AZT is only one of the drugs. AZT responds to the viral activity in a person's body, but there are other drugs which also help to stave off the particular infections which are especially dangerous to people who are HIV infected. Those are important.
Where does a person go to?
By the way, the fact that Medicaid covers AZT in every state in the country shouldn't be reassuring. We know that only half the poor people in the country are covered by Medicaid. So the point is that Medicaid as a system of protecting the poor in terms of their health care needs in general has been inadequate, and there's no reason to believe that it's going to become more adequate in meeting the needs of people with HIV infection.
Well, I know as part of the public health field, you're planning for the future. I read one thing that either AZT would cost billions of dollars in the next coming of years. Well, where's the money going to come from?
The federal government is going, you know, we have a disaster that's occurring today because of a hurricane. The federal government is going to move in with disaster relief. AIDS is not only a human disaster for those with HIV infection and for their families. It is a social disaster for the communities within which it's occurring, and it's localized. It's New York, it's northern New Jersey, it's Boston, it's Miami, it's Dallas, it's San Francisco. Of course there are AIDS cases all across the country, but the real burden of AIDS is in our major metropolitan areas, and they can't pay it themselves. The only way to make sure that people get the drugs they need, the care they need, is if the federal government picks up the tab.
David, we're going to a break now, but I'd like you to think about the question, is AZT the answer to AIDS? And we'll cover that right after this break. You're watching Lawline. Stay with us.
My father taught me to steal and to pitch. Today I struck out 7 and stole home. I think Dad would have been proud. Coach was. He said he wished Dad had taken as good care of himself as he did of me and Billy. Billy won't talk about it, and Mom can't stop crying. I don't know what it's like to have a heart attack, except I can see it hurts. It hurts bad.
You can help prevent heart disease. We can tell you how.
My father, Gordon McRae, was one of the biggest stars in musicals. He was also an alcoholic. When I was little, I thought I could stop my dad from drinking. But only the alcoholic can do that. And finally, my father got help and stayed sober the last 7 years of his life. I was so proud of him. Alcoholism is treatable and preventable. Be alert to signs that you might need help, especially if you're the child of an alcoholic. For information, call the National Council on Alcoholism, 1-800-NCA-CALL.
talking computers, high-speed braille printers, new technology helping blind and visually impaired people participate fully in today's computer age.
And removing the top of page.
For more information about putting high technology to work for blind people, write American Foundation for the Blind, National Technology Center, Box 111, New York, New York 10011. The American Foundation for the Blind.
Hello, I'm Alan Schnorman. Today's topic is AIDS. With us is David Hansel. David is the head of legal services for the Gay Men's Health Crisis. Also, we have Professor Baer. Professor Baer is with the Columbia School of Public Health. David, I asked you before, is AZT our answer? And your answer is?
My answer is medical treatment, I think, is the answer, and AZT is part of that answer. I'm not a medical expert, I'm a lawyer, but I think most medical experts think that the way we're ultimately going to deal with AIDS is through a sort of jigsaw puzzle approach. We're going to need a variety of medications. We're going to need medications like AZT to counteract the virus itself. We're going to need medications to rebuild the immune system, which is so ravaged by AIDS. We're going to need medications which will help to stave off particular kinds of infections, which can be lethal for people with AIDS. We're going to need a number of things, but AZT is part of that. We're still at a fairly early stage.
Professor Baer, somehow I still have this image you drew for me before of literally people dying on the streets in New York City in the next few years. Well, what's going to happen to our whole economy? What's going to happen to, are people going to stop moving out of the city? What?
I mean, there is a risk that when corporate leaders learn that it's difficult to get a hospital bed in New York for elective surgery, that the thought of moving to New York or moving a corporation to New York becomes very much less appealing. We are a city beset by an enormous number of problems, from crack to mental illness to child abuse. AIDS is just one of those enormous problems, and New York City simply can't solve its problems by itself. I mean, it sounds good to say that New York should pick up, deal with its problems by picking itself up by its bootstraps.
We always have.
Well, and lots of people have suffered as a consequence. Whether we will solve our problems, I can't tell you, but I can tell you one thing. New York City doesn't have the money alone to solve these problems. AIDS is a national problem, and as the President's Commission on the Epidemic said 2 years ago, it requires a national solution.
David, if I gave you power, what would you do?
Well, I think the first thing I would do is come up with money. Money is going to be the answer to the problem, I think, in many, many ways. The research that we need, the treatments that we need, they're only going to come, as Professor Baer says, if government antes up and makes the commitment to solving the issue.
By the way, we are the only country where we have to ask the question when someone is sick, who's going to pay for it? The only advanced industrial society that doesn't make sure that every citizen has access to health care regardless of the ability to pay. The Canadians have a system, the British have a system, the Germans have a system, the Swedes have a system, and somehow we have 40 million Americans without any health insurance.
David, you're painting a picture. If the money has to come from somewhere, and locally, health care, of course, now is a local and a state question. Right. And it's funded by the state and as well as by the city. A major part of our budget is health care. And of course, the revenues are limited. Right. So what you're really talking about, unless this panacea comes from the federal government, which may or may not come, right, is diverting funds from other areas of the city budget.
It has to come from the federal government. Read my lips. Taxes.
I think it's also important to recognize, though, that a lot of these costs are not avoidable. We're going to end up paying for them as a society one way or another. If people end up in the hospital critically ill, someone is going to pay that cost. So in many situations, if we come up with the money up front, we may in the long run actually save ourselves as a society considerable expense. But it's going to be expensive.
Of course, when you talk about a hospital bed takes years. It takes planning. It takes approval. It takes finding the place. It takes building it. It takes
nurses. It takes nurses and more nurses. There are many places that have hospital beds that are physically there but are closed because the nurses are not available. As I said to you earlier, we have known for a long time what the situation would look like in 1991. We've known for 5 years. And people kept talking about 1991 as if it was 100 years away. We've done very little. We don't have nursing home beds for people with HIV infection, who don't need hospitalization, but who can't care for themselves.
Let me ask you this, Professor. If there's 1 million to 2 million people out there with the AIDS virus, and yet only 100,000 people now have come down with AIDS, so we're dealing with either 900,000 or 1.9 million people out there who don't know they have AIDS.
Right.
Are they now giving that AIDS to other people?
Well, gay men, who were the group most at risk for HIV infection early on in the epidemic, have changed their behavior whether or not they've been tested. Not all of them. Some people have changed their behavior and have then gone back to older forms of behavior. But the fact that someone hasn't taken the test doesn't mean that they haven't changed their behavior. And the fact that someone hasn't taken the test doesn't mean they don't suspect that they might be infected. Testing has an important role to play, I think, in getting some people to change their behavior, and it certainly has an important role to play in getting people to come forward for therapies. But we shouldn't be misled by the vision that unless we mandatorily test everyone, we're not going to be able to educate people about changing their behavior. And the most important thing at this point, as important as therapy is, and as important as it is to talk about the cost of therapy, the most important thing at this point is to continue the efforts at modification of behavior, because if we don't do that, the virus is going to continue to spread, and people will continue to get sick, whether they're men, whether they're women, whether they're adolescents, whether they're children.
David, what are the most glaring part that people with AIDS, what's most frightening for them? I mean, you're their lawyer. What are the most common problems that come across your desk?
Well, the problems are really global. We see, as I referred to earlier, we see the results of people's antibody status or their AIDS status becoming known to employers, losing jobs, becoming known to landlords.
Can an
losing their
employer
apartments.
fire an employee who has AIDS?
Legally, no. In New York State, New York City, people have protection against that, but it doesn't mean it doesn't happen.
Can a landlord evict a tenant who has AIDS?
Absolutely not. Again, in New York. There are a number of states in the country, however, where there is not that kind of protection
Can a
in place.
doctor refuse to treat a patient who has AIDS?
No.
Can a dentist refuse to treat someone who has AIDS?
No. Any of those things would be unlawful discrimination in New York State. But half the states don't have that kind of protection, which is why we need it at a federal level. And it looks like that may be coming down the pike this year.
David Hansel from the Gay Men's Health Crisis, thank you very much for appearing on Law Line.
Thank you.
Professor Baer, it's been very interesting. Hopefully some of the things in your crystal ball will not come out.
I hope so.
As you
I hope
pictured
so.
it from Columbia University. Thank you very much for appearing on Law Line. And as always, this is Alan Schnorman, and thank you for watching Law Line. Still on camera. Oh, that was...
You have been watching Law Line with your host, New York trial attorney, author and lecturer, Alan Schnorman. Mr. Schnorman will be back with you next week at the same time. If you have any questions or comments about this week's program, please write to Law Line, 27th floor, 63 Wall Street, New York, New York, 10005.